This is Urban Health Today. I'm Tamara Thomas, editor-in-chief of Urban Health Today, and I'm speaking with Dr. Ashley Williams, a trauma and burn surgeon at USA Health University Hospital and advisory council member for the Ad Council's Youth Gun Violence Prevention Initiative, and Ro Patrick, senior vice president for campaign development at the Ad Council. Recently, the Ad Council and a coalition of healthcare partners launched Agree to Agree, a first of its kind initiative to address one of our most pressing public health crises today, gun violence. Dr. Williams and Ms. Patrick are here to talk about this national cross-sector youth gun violence prevention campaign with a public health approach. Thank you both for being here today.
Thanks for having us.
I really appreciate having you. All right, let's get started. Please talk about your respective backgrounds and the work that led to this initiative.
I'm happy to go first. So my background is in advertising and marketing, but currently at the Ad Council, I lead all of the campaigns that we do on gun violence prevention and have been for about 7 years. And so, with gun violence in this country being such a big, complex, and nuanced issue, the work that we do at the Ad Council is through communications, but looking at it really through multiple vantage points. So, just as my background is, I've led the work that we do here at the Ad Council with our partner Brady, which includes our End Family Fire campaign that highlights the importance of secure firearm storage. And then a more recent campaign called Pause to Heal. That's also with Brady and with the Illinois Department of Public Health. That campaign is focused on educating individuals living in the state of Illinois about firearm restraining order, which is the name of the red flag laws that's in the state. Additionally, kind of takes us to the latest effort in my portfolio, which is Agree to Agree, which I know we will talk a lot more in this conversation.
Right.
That campaign is in partnership with a coalition of healthcare and business leaders across the country, building and starting from common ground to raise awareness that gun injuries are the leading cause of death for children and teens in this country and what we can do to address it. So that's really the place that I come from in this conversation. So I'll hand it to Dr. Williams.
Yes, thank you. So I am trained as a trauma surgeon. I'm double boarded in general surgery and critical care. And so I work at a level 1 trauma center with a catchment area that spans 3 states. So we're very busy in terms of taking care of injured patients. And that includes children and adults who are affected by gun violence, by bullet wounds. And so I am one of the people who are ready and have the skill set and the knowledge to be able to take care of people when they come in. They woke up that morning, brushed their teeth, expected to go to work, and for whatever reason, they didn't make it back to the dinner table that evening. And so I have the privilege and really the honor to be able to facilitate getting our patients back home at the end of the day. So I'm very close to seeing the impact of gun violence. And it affects me not only in a professional way, but it also affects me on a personal level and as a community member on that level. And so it's very important for us, like many disease processes, we get outside of the hospital walls and we really focus on prevention. And so the same is true for gun violence.
So can you discuss the Agree to Agree campaign and explain why the Ad Council and its partners chose a public health approach to addressing youth gun violence?
Yeah, I'm happy to take that. And I think, we're in the midst of a devastating gun violence crisis in this country.
Yes.
I talked about sort of it in my intro, but it's worth repeating that firearm injuries are now the leading cause of death for children and teens in this country. And not just for 1 year, it's been for the last 3 years. And so for us, Agree to Agree is really around uniting health systems, hospitals across the country. We have partners in red states and blue states, in rural, urban and suburban, and all of us together bringing urgent attention to tangible things and nonpartisan things that we can do to make a difference. And we call it Agree to Agree because it's really grounded in the fact that while this issue of gun violence can feel sometimes really divisive, right? But when at the end of the day, we know when we look at our research that there's so much more that we agree on than we actually disagree. And so we want to lean into that, especially when we are centering it on children's safety, because none of us want kids to be hurt or kids to die. So for Agree to Agree, in this initial phase that we just released, there's two different audiences that we are talking to. One is talking directly to parents, and those that really have, youth in their lives. And then the second is reaching healthcare professionals who are, like Dr. Williams, on the front line of this crisis, and really trusted member of the community in keeping our families and our children safe. I'm sure that, Dr. Williams can talk a lot more on this, but what we have heard from, and as we talk to our partners in healthcare and hospital systems, they have taken so much significant action already in mitigating this crisis. So, including screening for risk of gun violence in routine visits, kind of talking about secure storage of guns in the home in the same way that you would talk about access to medication or bike helmets or even seatbelts. So, right, normalizing those conversations and making it part of preventative care is just a really important way to keep our families safe. So that's really why we are looking at this through the lens of health and why we are working with hospitals and healthcare system on this campaign.
It's extremely important for us to not only be reactive, which is a lot of what I do as a trauma surgeon, but to really be proactive, and to get out in front of it. And I know we'll get to this, and I'll talk more about it. But experiencing violence is like a disease in many ways. That there are specific etiologies or specific root causes that we can identify, and we can address those things. And when we talk about disease processes, we talk about root causes, and we talk about treatments. And one of the best treatments is really prevention. And so it's extremely important for us to focus on education, focus on, awareness, focus on getting the word out that there are things that we can do, just as everyday people in society, who are doing our best to make it from one day to the other. There are tangible things that we can do to be a part of the solution to such a big issue.
Why is youth gun violence considered not just a public safety issue, but a public health crisis?
Yeah, it's absolutely both, really. And it is very much a public health issue and a public health crisis,
Right.
because, again, we talk a lot about death, from gun violence, and that is huge. There are so many years of life lost, that young people haven't been able to reach their full potential because they've been victim to gun violence, and it's led to mortality, to their death. But the other thing that we don't talk about as often is the morbidity. So, what does it look like when you're a survivor of gun violence? And survivors have injuries that are that continue to affect them, persistently affect them in their quality of life. And then beyond the physical manifestation, the physical injuries, that patients sustain, which are significant, you also have the psychosocial and the emotional toll, that comes with those wounds. And so that not only affects patients, but it affects families and it affects communities. And we don't talk a lot about the fear component and that fight or flight stress response that many of our children don't get to auto regulate, don't get to come down from that fight or flight response, depending on the community and the circumstances that they find themselves in. And so the chronic stress and community stress, I don't think is emphasized enough in terms of how that leads and how that influences our health outcomes, and can really influence us to have poor health outcomes. So it's absolutely one of the social determinants of health, and one of the things that we can address to try and reach the highest level of health that we can for our communities at large, but particularly our youth.
There's also, I would imagine, people who don't want to go outside for fear of gun violence. And so that creates another tendril to this, because now people are not getting fresh air, people are not getting exercise from walking, people are not getting to socialize as much, can't see their neighbors because they're fearful of gun violence.
Absolutely. The effects can be so far reaching. And it's definitely adds to the complexity of having evidence-based strategies, that can mitigate those risks of violence for sure.
I 100% agree with Dr. Williams. I think, she talked about like the ripple effect, which is how we think about there's the folks that are sort of directly impacted in the physical harm, and then there is the ripple effect to the family, to the community, exactly what you were talking about, to even wider than that. So really kind of getting to the root causes of it and making sure that we are thinking about preventative care. And it's so much easier to have a conversation when you're coming in for your annual visit to talk about, whether it's secure storage of a firearm or screening for any sort of risks. So much easier to have that conversation than when you are sitting across from a parent and saying that whether their child has, been severely, injured or have died. So it's sort of the going back to the importance of preventative care that Ashley mentioned earlier, that's just so important.
How does Agree to Agree specifically engage youth communities? And what strategies are you using to ensure the campaign resonates with young people directly impacted by gun violence?
Yeah, so the first phase of Agree to Agree that we just released speaks directly to parents and those with youth in their lives, as well as healthcare professionals. And that is intentional because we really believe that it's the adult's responsibility to protect and keep children safe from gun violence. So whether that is parents having conversations about secure gun storage with other parents or other adults, or clinicians having that screening conversation around gun violence in routine visits. With that said, I think as what we have released this past month is just the very beginning of a multi-year, multi-phased approach. So in the coming weeks and months, we're going to be rolling out additional assets for different audiences to really address all forms of gun violence, because we know that the solutions for different types of gun violence can be different. So solutions for unintentional shooting could look different from preventing firearm suicide, could then also look different from preventing interpersonal violence. So, we need to, as we expand Agree to Agree in the coming months and years, to make sure that we are really looking through a holistic lens. So that could include messages that reaches youth directly. But in this first phase, our messages are directly to adults.
I did see some of the videos on the Ad Council's YouTube page. Walk me through what that consultation with the parent, I'm assuming this is a pediatric visit. Walk me through what that would look like. So I come in with my child for a well child visit, and you're talking to me about gun violence. How does that walk me through that?
So I think this can take place, or these conversations, this dialogue exchange, can take place in a variety of different venues. One, which you're mentioning, is in the primary care office with the pediatrician or the family medicine physician, and many of those. I'll say checkups are well checkups. And so it's about the holistic health of that child. And as not me, but pediatricians, in that setting, would ask about, school. How is school going? How are your grades? They'll also ask about other forms of safety in the home. So there's a very wide span of questions that the physician is asking to the child and to the parent to really get a full scope or a full overview of what this child's health looks like. And what we've come to learn is that there is a gap that has been identified in that process of understanding the child's full health. And that gap is that for a long time we have not asked about firearms in the home and firearm safety. And so not only can we assess if there's a need or if there is an issue, but we can also offer resources, offer things that really equip and resource our families to better protect themselves, which ultimately leads to improved health outcomes. I hope I answered your question.
So, okay. So you encounter a child or family. Your role is to educate these providers who are encountering these families. I'm not asking you specifically as a pediatrician, because I know you're not a pediatrician, but Okay, so let's say I'm a pediatrician and I encounter a family that there are some red flags. Then what?
So there's an opportunity there that presents itself. It's an opportunity to educate, to inform, and to provide resources. So it could be as simple as asking, a few questions. One, do you have firearms in the home? Two, are they stored safely? Do you know what stored safely means? And so there's an opportunity there to educate about safe storage. And that education goes a long way. But there are also other resources, such as, there are many grant programs or many facilities or health systems that are able to actually give gun locks to families. But I think at the basis of everything that we're building upon is that education piece to make people aware that one, there are many families that have firearms in the home, but two, we can also give you the education, the knowledge to know that it has been an issue for others. How do we help to make it to where it's not an issue for you and your family?
Okay. From a public health perspective, what types of data or outcomes will indicate to you that the campaign is succeeding?
So from the ad council's perspective, as with every campaign that we develop here, we will evaluate knowledge, attitudes, and behavior change among those who are aware of our campaign, so who have seen our PSAs and all of the work, versus those who have not. And we do that through an ongoing tracking study, which is a quantitative survey. We look at website engagement and other resources, and we look at things like, are folks aware of the statistic that gun injuries are the leading cause of death for children and teens in this country? We look at whether they agree that everybody has a role to play in preventing youth gun violence. We ask, have they engaged in conversations about preventing youth gun violence? So these are the type of things that we ask in our survey, and see if we're sort of moving the needle, um, throughout months and years. And then as for sort of general outcome, ultimately our goal here for the campaign is to curb and reduce the number of firearm related injuries and death impacting youth. That's something that's not going to happen overnight, right? So it's going to take us time to get there. So in the meantime, while we are launching this campaign, we're going to measure those behavior change that and attitude changes that I mentioned to really start to reposition this issue at this health and safety issue at the core. And help folks across the country start to have productive conversations, whether that's with other adults, or with their clinicians, starting to really normalize that it's okay to talk about guns and gun safety and making sure that your guns, if you are a gun owner, that those guns are securely stored with people in your life, so that we can really keep our families and our loved ones safe.
It's no secret that gun violence disproportionately affects marginalized communities. How's this campaign addressing that disparity?
Yeah, so as I sort of mentioned at the top, this issue is massive and big and nuanced, and it
Mhm.
really requires multi-phase, multi-prong approach. It's not a one-size-fit-all solution. And so this first phase, we are looking to really raise general broad awareness of the fact that firearm injuries are the leading cause of death for children and teens in this country. What we're trying to do is reach as many people as possible with this sobering statistic to start to inspire those initial conversations. As we look to expand the campaign in the coming months and weeks, we're actually going to be working with community violence intervention leaders and experts in the field, including Dr. Williams, who do a lot of work in this space, to start to uplift that important work that folks are doing, especially in areas that experience a high concentration of gun violence. So that work is really important to us. We're in the very early stages of that campaign, so I don't have a ton to share right now, but the goal is to shine a light on the work and the success of community violence intervention in helping to make communities safer, in disrupting the cycle of violence, and really changing the narrative and reinforcing the fact that gun violence is preventable and not inevitable in any community. So lots more to come in our CVI or community violence intervention work, but it's certainly the next phase of Agree to Agree.
What actions or resources can healthcare professionals utilize to support and amplify the message of the Agree to Agree campaign in their communities?
So healthcare professionals and healthcare systems are oftentimes critical stakeholders in many communities throughout our country. And so I think there's a huge opportunity for us in the healthcare space to really be a part of educating and informing, but also a part of looking toward evidence-based solutions. And we talked a lot about prevention and intervention. So on the prevention piece, it's absolutely important to treat violence just like we would any other disease process like hypertension, diabetes, obesity, all the things. We know that there are risk factors for the development of those disease processes, and the same is true for experiencing violence. The number one risk factor is a history of violence. So we know that it can often be chronic and repetitive and persistent. And so it's very important for us to really be in tune with evidence-based practices as people are studying this, just like we've studied cancer and every other, health issue. We're studying violence, and we're looking at what strategies can we deploy? What things can we do that have been shown to improve a quality of life and reduce the risk of experiencing violence? So, on the preventive front, there are things that we can do outside of the hospital, in the clinics, at our primary care visits, which we discussed, in the schools, in all the places that our kids find themselves, in the churches, et cetera, community centers, et cetera. But also on the intervention side. So I'm a trauma surgeon, and I take care of patients when they come in the hospital afflicted by these injuries. And so that gives us a huge opportunity to be able to assess for things that we know put our patients at risk for re-victimization, re-injury, and retaliation. So what are those things that influence our health outcomes, such as employment, education, food insecurity, transportation, lack of insurance? So all of these things really shape our ability to recover from the physical injury, but also should be assessed and addressed if there are gaps and needs that have been identified. And so you'll find that across the country, many trauma centers have hospital-based violence intervention programs where we can meet patients at the bedside. Yes, our team is equipped to take care of their medical issues, but there is a movement towards complementing that medical care with social care. And so being able to assess the needs of our patients and provide them with the resources that they need to fill those gaps and to lower the obstacles, to allow them to help them to overcome the barriers to complete and full recovery and to achieve the best quality of life that we can. So there are so many opportunities for the healthcare system to really be partners and have a leadership position in this public health crisis as we search for evidence-based solutions. But I love this campaign because we're starting with education and awareness, and that is extremely important.
Do you have any literature like posters or flyers?
Oh, yeah, on hospital-based violence intervention programs,
Well,
there's
just for, yeah, for people to see as they, come.
absolutely. The place that I would start is agree2agree.org. There are a lot of resources, and as you mentioned, you saw some of the videos, but different resources and information there at the website. I think that's a great starting point.
You just talked about partnerships. It sounds to me like mental health care needs to be, they need to play a larger role in this. Have you partnered with the mental health community at all in this
Abs-
initiative?
Absolutely. So there is when I said social care, that
Mhm.
certainly encompasses mental health services for sure.
And I'll just add that, as part of Agree to Agree, absolutely, I think suicide prevention, mental health, those are really important pieces of the puzzle. It's the why and the how of preventing gun violence. So we have subject matter experts that works deeply in the space of suicide prevention and mental health, helping to inform the work that we do. So we really do think that they go hand in hand.
We live in a highly polarized time. where people are dug into their beliefs, and common ground is now a dirty term. So how will you bring clinicians who serve in areas where guns are part of their culture to this initiative?
Yeah, I super appreciate you asking this question because, building agree to agree from a place of shared common ground and agreement and convening voices from many, many different backgrounds is something that we're really proud of. So as we were developing this campaign over the last 12 months or so, we have really created a strong and vast network of health systems in red states and blue states, urban, suburban, rural, and we have gotten input from gun owners as well as non-gun owners because really everyone has a role to play here, including clinicians who are gun owners themselves. So we know that we can't do this if we don't include everybody in the conversation because this is a big enough crisis that we need everybody at the table. So, I know Dr. Williams has talked a lot about the role of healthcare professionals, but I think really kind of double downing on that point, healthcare professionals, clinicians are so key to helping us solve this crisis and starting the conversations with patients and families in a way that's non-judgmental. It's collaborative, and it's really at the end of the day all about safety and keeping children away from harm. And we actually think today agree to agree just as a philosophy is more important than ever, right? And when we think about gun violence, again, it feels like sometimes it's really divisive with no common ground, but we have research that shows that we agree on so much more than we think. So, some of the things that we agree on include firearms should be stored securely, that having conversations about gun violence should be normalized, and that we all have a role to play to ensure that maybe in a year or two, gun violence is no longer the leading cause of death for kids in this country. And so these are the things that when you put kids at the center of it, that we like, no one wants kids to die, no one wants kids to be harmed. So that's really where we are really going to focus on our efforts on the things that we can all agree on this issue that can sometimes feel really big and scary and divisive, and lean into that.
Are you working with the legislative body at all? I mean, to me, it feels like so you have this great initiative. You're working with clinicians, you're working with mental health care, you're working with community leaders and so forth. Um, but there's the other part of it. There's the getting the guns out of kids' hands, off the streets, getting rid of that easy access to guns to begin with. So what is the ad council doing in terms of working with legislature to create?
So, everything that we do at the Ad Council and really what makes us unique is that we are nonpartisan, non-political. We don't get into, anything that relates to laws or advocacy or legislation. There's a lot of great folks doing work in that space, and that's really important. But we are really focused on the steps that individuals can do and the behaviors that we can all do to prevent gun violence. And that's really the lane that we're going to stay in and give parents and healthcare workers and clinicians steps that they can do themselves to really help prevent this crisis.
Well, I'm looking forward to seeing more of those video ads then. That's going to make a huge difference. Dr. Ashley Williams and Will Patrick, thank you for your perspective and for your time today. I really appreciate it.
Thank you so much for having us. Really appreciate you.